You can have a cataract and still not need surgery, and you can sometimes read a surprisingly good line on the eye chart, but still be struggling enough that cataract surgery is reasonable. So how do you actually know when the time is right? The answer is not based on the cataract reaching a particular size, and it should not be based on one eye chart number alone. The real question is cataract affecting your vision and your everyday life enough that the likely benefits of surgery now outweigh the risks and the inconvenience for you? In this video, I'll explain 7 practical signs that it may be time to consider cataract surgery, when it is perfectly reasonable to wait, and why 2 people with apparently similar cataracts may make completely different decisions. My name is Mr. Mohammed Ahmed. I'm a consultant ophthalmologist specializing in cataract, corneal, and vision correction surgery. This video provides general education and does not replace an individual assessment with your own eye care professional. Now, first I'll discuss what a cataract is. Inside the eye is a natural lens. When we're young, the lens is normally clear. Over time, the lens can become more cloudy, and that clouding is called a cataract. A cataract can make the vision more blurred, it can make it more dim, more sensitive to glare, less colorful, or simply less clear and comfortable than it used to be. Cataracts usually develop gradually, which means that most people do not always notice how much their vision has actually changed. Sometimes it's a relative who notices first, or the patient suddenly realizes that one eye sees much more clearly than the other, and they cover each eye in turn. The presence of a cataract does not automatically mean that surgery is needed immediately. For most uncomplicated age-related cataracts, surgery is normally considered when the visual symptoms begin to interfere meaningfully with day-to-day life. Now, the first sign is that new glasses no longer solve the problem. And one of the first things that many people do when they notice that their vision's becoming more blurred is that they visit their optometrist and update their glasses. And in the early stages of a cataract, a new prescription can help, but eventually the clouding inside the lens may become the main limitation. At that point, changing the glasses may make relatively little difference. You may be told, for example, we can improve the prescription slightly, but we can't make the vision completely clear. Now, that can be an important sign. However, blurred vision is not always caused by a cataract. So other things like dry eyes, corneal or macular problems, glaucoma, and other conditions can also affect the vision. So before assuming that cataract surgery is the answer, the eye needs to be examined properly. The surgeon should be reasonably confident that the cataract is actually causing some of the symptoms, and that removing the cataract is likely to improve the vision. Now, the second sign is glare and difficulty with night driving. Some patients can still read a reasonably good line on the eye chart in a bright consulting room, but when they drive at night, everything feels very different. So the headlights may spread out, streetlights may appear surrounded by glare, and the contrast between dark roads and bright lights does become more uncomfortable. And some patients gradually stop driving at night because they no longer feel confident. This is one of the reasons why visual acuity alone does not tell the whole story. A standard eye chart measures high contrast vision under controlled conditions, but it does not fully reproduce nighttime driving, glare, or reduced contrast. NICE specifically advises that access to cataract surgery should not be restricted solely on the basis of visual acuity, because symptoms and effects on quality of life also matter. So if you are increasingly avoiding nighttime driving or feel less safe and confident than you did before, then that deserves a proper assessment. The third sign is that reading computer work or your job becomes more difficult. Now, not everyone's main problem is distance vision. For some people, the cataract mainly affects the tasks that they perform every day. So you may find that reading becomes more tiring, the words look more faded rather than sharp as before. You need more light than before. Computer work takes longer. Small print can become more difficult. You struggle to recognize faces across the road, or detailed work becomes less comfortable. The effect also depends on the individual. A small reduction in vision may not bother someone who does relatively little close-up work or visually demanding work, but it can have a major effect on someone who, for example, drives professionally, uses several computer screens, reads extensively, performs very detailed manual work, or depends heavily on clear vision to remain independent. The right time for surgery is therefore partly determined by what you need your vision to do, and it's not always the same for everyone. Now, the fourth sign is that the colors can look duller or the world overall seems a bit dimmer. A cataract does not always produce obvious blur. Sometimes the main change is that the world looks less bright, the whites may look more yellow or cream, the colors overall appear washed out. You may need stronger lighting indoors, or you may feel as though you're looking through a slightly dirty window. Because cataracts normally develop gradually, the brain adapts, but many people do not appreciate how much color and brightness they've lost until after the surgery on the first eye. They may notice then that the operated eye sees a lot brighter, whiter images, while the unoperated eye sees a duller or more yellow image. The loss of color, vision and glare are examples of visual problems that may not be captured by visual acuity testing alone. Now, the fifth sign is you're changing your life to cope with your vision. This is one of the most useful questions I ask. What have you stopped doing because of your eyesight? Have you stopped driving at night? Do you avoid unfamiliar places? Have you stopped reading for pleasure, for instance? Are you relying more heavily on your partner or family? Do you avoid stairs in poor lighting? Have you given up a hobby? Are you arranging your day around the times when the light is best? Sometimes patients say that my eyesight is not really affecting me, but when we explore it further, they have already made several significant adjustments to their life. They've adapted their life to the cataract and have gradually accepted those restrictions as normal. Cataracts can affect daily activities, independence, and quality of life, and these functional effects should form part of the decision making around the surgery. The question is not simply how many lines can you read? It's also what is your vision preventing you from doing? Now, another sign is that the difference between the two eyes becomes more troublesome. So the cataracts can affect both eyes, but not always equally. So one eye may become much more blurred than the other. So at first, the better eye may compensate. So with both eyes open, you may feel that you're still managing reasonably well, but you may notice reduced depth perception, difficulty judging steps or distances, eye strain, a feeling that the eyes are not working together as well, or a marked difference when covering one eye at a time. Sometimes the surgery on the first eye also creates a temporary imbalance between the two eyes. If the other eye has a very different prescription, or if there's a significant cataract. That does not mean that everybody needs both eyes operated on immediately, but the binocular effect, the way the two eyes work together, should be considered, and not just the vision in each eye separately. Now, another sign is that the benefit now feels worth the operation. Cataract surgery is an operation, although it's commonly performed and is usually very successful. It is not completely risk-free. So the correct question is not can the cataract technically be removed? It almost always can be. The correct question is my vision bothering me enough that I am prepared to accept the small but real risks and the recovery involved? For one patient, the mild glare may not justify surgery. For someone else, the same glare may prevent them from working or driving safely. Neither of those patients is necessarily making the wrong decision. The timing is something that's personal. NICE recommends that the decision should include how the cataract affects the person's life, quality of their life, the likely benefits, the risks of the surgery, and what may happen without surgery, and whether the patient actually wants the operation. Now, it is often completely reasonable to wait if your vision still meets your needs. So glasses provide a satisfactory improvement. You are comfortable driving, reading, and carrying out your normal day-to-day activities. The cataract is mild, or you simply do not feel that the benefits are worth it for you at the moment. You do not need surgery just because an optometrist or a doctor has identified a cataract. In most routine age-related cases, there's no need to rush solely just because the cataract is present. You can normally monitor the symptoms and reconsider surgery if your vision gets worse or your needs change. Waiting is not the same as refusing surgery forever. It just means not yet. Sometimes patients ask, can you wait too long? It's a common concern, and patients sometimes believe that a cataract has to become ripe before it can be removed. I would say that it's an outdated idea, and with modern cataract surgery, the cataract does not necessarily need to reach an advanced stage before considering treatment. Equally, there's usually no advantage in waiting until you can barely see. A very advanced or dense cataract can sometimes make the surgery more technically challenging, and prolonged poor vision can affect independence, confidence, and safety of the individual. Uh, there are also less common situations where an ophthalmologist may recommend surgery for a specific clinical reason, even if the patient is not severely troubled by blurring. So, for example, the lens may be affecting the pressure or the anatomy inside the eye, or the cataract may prevent adequate examination or treatment of the back of the eye. Those are individual clinical decisions, and for the typical age-related cataract, however, the timing remains mainly a balance between symptoms, their lifestyle, the benefit, and the surgical risk. Now, it's important to understand that the eye chart number alone does not determine the decision. You may hear vision described as 6/6 or 6/12 or another visual acuity measurement. Now, these numbers are useful, but they're not the only part of the assessment. So, two patients can have the same eye chart results, but very different experiences. One may function perfectly well, but someone else may have severe glare, poor contrast, and driving. And that's why the UK guidance says that cataract surgery should not be denied simply because the person can still read above a particular line on a chart. The number actually matters, but the person matters more than that. Before the surgery, the surgeon should examine the whole eye. So that includes the cornea, the front, the cataract, the retina, the back of the eye, the nerve, because it's important to assess all of these structures, as removing the cataract cannot repair all other eye conditions. If someone has significant macular degeneration or glaucoma or diabetic eye disease or a corneal problem, then the final improvement may be limited. And that does not always mean that surgery should not be performed. It just means that the expected benefit needs to be discussed honestly. Now, sometimes the cataract and other eye conditions are both contributing. The surgeon's job is to estimate how much of the problem is likely to improve after the cloudy lens has been removed. No ethical surgeon would guarantee perfect vision. Now, if you're unsure if the time is right for you, I would ask yourself 5 questions. So, number one, is my vision interfering with something that matters to me? Am I avoiding activities because I no longer find them very comfortable to do? Uh, do updated glasses still provide enough improvement? Has an eye care professional confirmed that the cataract is indeed the main cause of my symptoms? And number five, do the likely benefits of surgery now feel worth the risk and the recovery to me? If the answer to most of those questions is yes, then it may be reasonable to have a cataract surgery assessment. If the answer is no, then monitoring is completely appropriate. A cataract assessment should not simply confirm that a cataract exists. It should also explore what symptoms you have, how they affect your life, what you hope to achieve, whether there are other eye conditions, what the potential benefits and limitations are, and whether you actually want to have the surgery. Measurements are also taken to calculate the artificial lens, which will replace the cloudy lens. I have separate videos explaining how artificial lenses are selected and whether glasses may be needed after the surgery. I won't repeat all of that here. The important thing is that deciding when to have cataract surgery comes before deciding which lens to choose. So how do you know when it is time for cataract surgery? It is probably time to consider an assessment when the cataract is affecting the activities that matter to you, and when glasses or brighter lights or simple adjustments are no longer enough. You may find it reasonable to wait if you are still functioning comfortably and the symptoms are minor. Do not base the decision only on how the cataract looks, and don't base it just on how far down the chart you get. And you don't need surgery simply because somebody says you have a cataract. The best timing is based on your symptoms, your lifestyle and your eyes, your expectations and willingness to undergo the operation. In the next video, I'll explain what cataract surgery actually feels like, including what you may see, hear and feel during the procedure, because many people delay the surgery not because their vision is good, but because they are frightened of the actual operation itself. If you found this video helpful, please consider subscribing and let me know in the comments what change in your vision would make you consider having cataract surgery. Thank you for watching.